Childhood obesity is on the rise, and experts are saying it's becoming a national concern, having an adverse effect on kids' lives.
Dr. Laura Farach, a pediatrician with Kaiser Permanente, Baldwin Park, is here to explain how kids are packing on the pounds at a younger age and what adults can do to help change this trend. First of all, good morning, doctor. Thank you so much for being with us.
Good morning. It's nice to be here.
It's great to have you. So what is the primary cause of childhood obesity?
Well, we have among the highest rates of childhood obesity in the world here in the United States. And we see it the highest in the lower socioeconomic groups and also in the higher socioeconomic groups, but much more so in the lower groups. And it's due to changes to the diet and physical activity that we've seen over the last couple of decades.
And let's talk specifically about the last couple of years. The pandemic had so many problems. Did it also affect the way our kids are eating?
Yes, so before the pandemic, we certainly had a problem with obesity, but the pandemic just made things worse.
And obesity is especially rising in kids around kindergarten age, so around 5 years old. Why is there more of an increase in this particular age group?
Well, what we're seeing is that the incidence of obesity is on the rise, as well as finding obesity at much younger ages and much more severe. And so the children that are kindergarten age who have an abnormal BMI, meaning they're overweight, are at much higher risk of becoming obese.
And why is that happening? Why are you seeing that more in that age group as opposed to other groups?
Well, what the studies are showing is that the obesity rates are just happening younger and younger and younger. And so it seems that we need to target those very young ages more so than even at the older age, because we have to try to prevent this.
Yeah, doctor, I think that there are some parents who think that maybe kids will just grow out of their baby fat and maybe it's just a stage. But you're talking about there being severe health impacts if we don't do something.
Yes, so we definitely know that children with early obesity are going to have increased risk for physical and mental health changes. We worry about diabetes, we worry about cardiovascular disease, mobility problems. There's just a long list of health problems that can occur from obesity.
So what should parents do? What's your advice to them?
Well, the first thing is to focus on maternal weight and try to get that under control. Start by breastfeeding. We recommend 2 years of breastfeeding. And then the family needs to make changes where there is physical activity together as a family, eating together for family meals. And I do see a lot of parents of toddlers who are concerned that their child is not eating enough. And so I would just caution you not to give toddlers junk food when they don't want to eat. And if your pediatrician is telling you that your child's weight is normal, then please be reassured by that.
Yeah, we are both parents of young
toddlers.
children, of toddlers, and getting them to eat a variety of foods, at least for my son, is a challenge. We're doing all beige foods. And as kids grow, I know their likes and interests can change with that, but as kids get older, how do you encourage them to eat healthier food?
It really starts at a very young age, and you just have to offer them those healthy foods, have those healthy foods available, and try to avoid, this fear that a lot of times parents have that their toddler's not eating enough. Try to avoid giving them junk food just so they'll eat something. That's really a mistake.
Yeah, and that's an easy thing to fall into. Is you don't want your kid to be hungry, so okay, fine, here, just
have a cookie.
Exactly,
right.
Exactly. So
don't do that.
Right.
That's right.
Well, that is really great advice. Dr. Farach, thank you so much for your time and for sharing this information with us.
No problem. It's good to be here.
Have a great day.